In today's video, we're going to find out how to fix bad breath and how to get rid of it permanently. Let's get into it. There are billions of bacteria that live inside our mouth at any given time. Some of these bacteria produce volatile sulfur compounds, which gives you that bad breath smell. 80 to 90% of bad breath is caused by bacteria inside our mouth, and the remaining 10 to 20% of bad breath is caused by external factors. Factors that contribute to bad breath include poor oral hygiene, periodontal disease, dry mouth, smoking, certain foods, postnasal discharge, acid reflux, diabetes, high protein diets, gastrointestinal disorders, kidney disease, liver disease, and certain cancers. Sometimes it's hard to know if you've got bad breath because we generally can't smell our own breath. Our brain tends to become desensitized to our own smells, such as body odor, perfume that's been on our skin for a while, or in this case, bad breath. There are 3 ways you can test for bad breath at home. Number 1 is the lick test. Lick the inside of your wrist or a spoon, preferably with the back of your tongue. Let it dry for 10 seconds and then smell it. Number 2, ask a friend or a family member that you trust to give you the truth. Number 3, bad breath detection devices. Devices such as the halimeter and breath alert device are not 100% accurate, as it detects VSEs, which, as we mentioned before, are the main compounds that cause bad breath, but they don't detect other compounds which may also contribute to bad breath. So these devices are good to use in conjunction with the other tests, but aren't overly reliable. Treatments will depend on the underlying cause. When leftover food particles stay in the mouth, this can cause a buildup of bacteria, which causes bad breath. Good oral hygiene is needed to remove the leftover food and bacteria. This includes brushing your teeth twice a day, flossing every day, using a tongue scraper to clean your tongue once or twice a day. This is one of the most effective things you can do to fix bad breath if it's caused by a bad oral hygiene. And if you have dentures, make sure to clean them every day. Saliva helps to wash away bacteria that causes bad breath. The reason we get morning breath is because we produce less saliva overnight. To prevent dry mouth, sip plenty of water throughout the day. Breathe through your nose, not your mouth. Avoid mouthwashes containing alcohol, as alcohol can dry out the mouth. Medications that cause dry mouth include diuretics, beta blockers, certain antidepressants, drowsy antihistamines, seizure medications, antipsychotics, Alzheimer's medications, and incontinence medication. You can use saliva substitute products such as gels and sprays, and chewing on sugar-free gum or sucking on sugar-free lozenges can help to stimulate saliva production. Certain foods can cause bad breath, including garlic, onions, canned fish, cheese, and coffee, to name a few. Unfortunately, even if you brush your teeth after some of these foods, particularly garlic and onion, you can still get bad breath when they get into the bloodstream and get exhaled through the lungs. Sometimes it can take more than a day for garlic breath to go away. There are some foods which can actually help to prevent bad breath. Crunchy foods such as apples, celery, and carrots helps to stimulate saliva production and helps to physically remove any trapped food particles in your mouth. Certain herbs such as parsley and mint can also act as a natural breath freshener. Studies have found that taking probiotics or eating probiotic-rich foods can reduce bad breath by reducing the amount of bad bacteria in the mouth. Results can be seen within a week. Look specifically for lactobacillus and streptococcus strains. Green tea and also black tea can help to prevent the growth of bacteria that causes bad breath. And they also contain polyphenols, which helps to reduce the sulfur compounds that cause bad breath. If you prefer not to actually drink the tea, you can use green tea as a mouthwash by rinsing and spitting it out. Speak to your healthcare provider to help you control any underlying conditions that may be causing the bad breath. Some of these may include diabetes, smoking, sinus issues, and acid reflux. And if you're looking for a quick temporary fix, there are several products that can help, such as mouthwashes, mouth sprays, breath strips, and breath pearls. And if you've tried all these tips and it still hasn't worked, make sure you speak to your dentist or doctor. So that comes to the end of the video. If you found anything useful in this video, please consider subscribing. Thanks for watching, and I hope to see you next time. Bye!